And just also please try to remember to speak slowly for our Spanish and ASL interpreters. Our Spanish interpreters this evening are Jacqueline and Elizabeth. So now we'll just have a few introductions from the Equity Office, from our Budget Office staff who are here, and from our Joint Inclusion Commissioners. So like I said, I'm Amanda Hasso. I work in the City of Austin's Equity Office. We also have Brandon managing the technology piece. He's from our office as well. And Rocio Villalobos, who's our Immigrant Affairs Coordinator in the City of Austin. I'll just provide a really brief overview of what we do in our relationship to this budget engagement work with the commissioners. So our Equity Office was formed in 2016 to focus on advancing equity in all aspects of city operations. And for the past several years, we have been working with the Budget Office and our Joint Inclusion Commissions who are here tonight to redefine what collaboration looks like and to be really deliberate in finding opportunities to advance equity through our city budget. So our equity officer, who's Brian Oakes, he calls the budget a moral document. So a moral statement that indicates our true values as a city. And he was planning to be here tonight with us, but unfortunately, his power has been out for many hours since this morning. So he is without heat or electricity. So he's taking this time to take care of his family right now. So right now I'll pass to Kevin from the Budget Office, who will give us a really brief overview of their work and their commitment to this process.
Hello, everyone. I hope everyone's staying warm and keeping safe. Like Amanda mentioned, my name is Kevin Romero, and I've been in the Budget Office a little bit over 2 years. And I'm just going to give you guys a quick rundown of Budget Office's involvement in this process. So this year, much like last year and years in the past, the Budget Office is going to attempt to elicit as much community input as possible throughout this budget process and through several different avenues. As in previous years, the Budget Office will coordinate with city departments to review the recommendations passed by the boards and commissions. These departments are going to be reviewing the recommendations that you guys will be working on in forums like the one tonight and the one next week. We will also be conducting our annual budget survey later this year. We're hoping towards the end of April or the beginning of May, where wide ranges of the community will be able to fill out the survey and provide their input online. Unfortunately, due to the financial constraint that we're in due to COVID, coupled with the 3.5 property tax revenue cap that the legislature bestowed upon us, the 21-22 budget development process will primarily focus on maintaining existing services. With these constraints in mind, we encourage the community and our boards to provide feedback on the efficiency, equity, and effectiveness of the existing services that the city provides. It is important, I do want to emphasize that the department's budgets are due to us, the Budget Office, May 7th, so of this 2021. Therefore, the recommendations, which should be passed in form of a resolution to the city clerk, should be submitted no later than April 9th, 2021. So that way it gives the departments the opportunity to include the recommendations upon completion of the review, of course, into their proposed budget submittal. So we're excited for another year of lively engagement process virtually this time around, where all the residents of Austin are afforded an opportunity to be heard. We look forward to hearing the discussion here tonight. So thank you.
Thanks, Kevin. Appreciate the Budget Office being here. So next, to introduce the Joint Inclusion Commissions, I'll invite Becky Austin, Chair of the Commission for Women, to speak with us.
Hi, everyone. Thanks, Amanda. I'm Becky Austin. I'm Chair of the Commission for Women and a member of the Joint Inclusion Committee. Really grateful that you're all here with us tonight in spite of the cold weather. I'm here representing the committee whose purpose is to advise the City Council on issues pertaining to diversity and inclusion. I'm going to list the Joint Inclusion Committee members so that you know who you're represented by, and many members of those commissions are here at the forum tonight. So it includes the Commission for Women, the LGBTQ Quality of Life Commission, the Mayor's Commission for People with Disabilities, the Human Rights Commission, Commission on Immigrant Affairs, Commission on Seniors, Asian American Quality of Life Commission, Hispanic Latino Quality of Life Advisory Commission, and the African American Resource Advisory Commission. As Kevin said, this is a challenging budget year for all of us, and so we want to make sure that we hear from the community about the most pressing issues and priorities that you're facing. And so we're here tonight really to listen to you and to hear from you. Your feedback helps us advocate with City Council and with City of Austin departments to address your needs during the upcoming budget planning cycle, as well as the work that we do throughout the year. We're also here to connect with each other. Whatever your race, ethnicity, gender, orientation, age, ability, status, or neighborhood, we're all part of the fabric of Austin. Your voices matter, and we want to hear from as many of you as possible tonight. Whether you're comfortable coming off mute and speaking up or putting your opinions and your ideas into the chat, we really want to hear from you, and we want to encourage you to be a part of the conversation. With that, I'll turn it back to Amanda.
Thanks, Becky. And for everyone who is just joining us, we are in the second of 3 Zoom meetings where we will be getting resident feedback on different outcome areas for the City of Austin. Tonight's focus is on health and the environment. I do want to remind everyone when they're on camera and off mute to please speak slowly for our ASL and Spanish interpreters. So thank you, Becky. So like I said, we're talking about health in our communities and the ways in which we can keep our communities healthy, particularly those residents most negatively impacted by a variety of different systems. So I'd like to invite Assistant Director of Austin Public Health, Adrian Stirrup, to share some of the city's strategic priorities and some of the budget investments related to health.
You're on mute, Adrian.
First time today. Thank you. I appreciate that. Again, so my name is Adrian Stirrup, and I am the Assistant Director for Health Equity and Community Engagement here at Austin Public Health. I thank you for the opportunity to speak with you all today. And really our focus when we're talking about health and environment and the indicators that are mentioned there, it's access to quality healthcare services. It's looking at items related to food security and nutrition. It's all of those things in our community that make up the social determinants of health. So how as we, as a health department, how can we recommend policy, system, and environmental changes that will support our community in achieving those quality of life outcomes? Some of the investments that we have been able to make based on the recommendations from all of the commissions have been across the gamut of those things. Most recently, additional investments in mental health services for communities of color and for members of the LGBTQI population. We've also looked to invest in food security. So this year it's the Equidot ATX bus that will go into areas of Travis County that don't have access to full service grocery stores to bring more fresh fruits and vegetables to those residents. It's things like the early pre-K classrooms, because we know educational attainment is a direct indicator to your health outcomes later in life. And we also know that in our communities of color, children who read later or don't read well often struggle later on in grades. So really making investments into our pre-K programs, making sure that they're free and accessible to any parent who wants their kid to enroll. Some other places where we've made investment is in our translation services. You can have the best system in the world, but if it's not equitably accessible to people with different language needs, then we've built it for naught. And so, of course, we'll go into more detail again later on tonight, but really where we strive as a health department is taking the monies that the city council has invested and putting them back into community so we can support those community-driven solutions to address some of the key factors that help people be healthy. Thank you.
Thank you, Adrienne. Really appreciate you being here. And to that end, you know, we're keeping the thoughts of keeping our thoughts with thousands of folks without heat and electricity, those who are unsheltered, especially in this harsh weather, and of course, all of those affected by COVID. So those are just some of the pressing health-related issues that we all know we are facing right now. But I'll invite Sarita Davis, who's the chair of the Human Rights Commission. If you could share a couple key challenges and feedback we've heard from community in relation to health and the environment.
Thank you, Amanda. Again, my name is Sarita Davis. I'm the chair of your city's Human Rights Commission. Thank you so much for joining us tonight to discuss health and environment and what you think the city should do budget-wise with regard to these issues. I saw something in the chat regarding reallocating funds or keeping the status quo. I want to stress that we are volunteers. We make recommendations to council. Council has to take our recommendations, but ultimately it's up to city council and then the city manager to implement anything they say they can do. So I want you to know that we work hard for you, but I also want you to know what our limitations are in terms of that. We are here to represent the mayor or city council members who appointed us to get feedback from you to take to them so that they can make the best decisions possible with regard to the city budget. In terms of health and environment, we all know COVID-19 has been devastating to many communities. Here in the city of Austin, the primary concerns are how COVID-19 is disproportionately affecting members of the African American and Latino communities here, especially along the Eastern Crescent. Proper facilities for testing and facilities to provide and administer the vaccine to those populations has been a paramount concern and a challenge. In terms of environment, and also in terms of health, a lot of people have had questions that hopefully can be answered here for you tonight with regard to Austin Public Health and why they can't do more. I think a lot of people don't understand the lack of funding Austin Public Health has always had. And that combined with being hammered with a pandemic that's never really been seen before, at least in my lifetime, has been extremely arduous and challenging for Austin Public Health. In terms of environment, the key thing my commission has heard about is with regard to I-35 and the restructuring of I-35, and again, how that will affect individuals who live along the Eastern Crescent in terms of their quality of life, the noise where the tunnel will be dug, and what communities that will possibly negatively affect. Again, those being predominantly African American and Latino communities. So thank you all so much for being here with us this evening, and I'll turn it back over to Amanda.
Thank you, Sarita. I appreciate you. So now we're going to get to the main portion of our meeting together tonight. For residents who are not commissioners, we're going to start with you. If you would like to directly address commissioners in this space, either vocally or in the chat. Please, either way, put your name in the chat so I can keep a stack, an order of who is next to speak. We have a relatively smaller group tonight, probably due to a lot of factors around weather. So, you know, we can also gauge how it goes, and it can be a little more informal. But yeah, we just want to hear from you 2 to 3 minutes if you are speaking uninterrupted, so you know we can really absorb what it is that you are asking or telling us about what health and equity means in your community. So some of the things that we're looking for tonight to be addressed are, when you think of health and the environment in Austin, what are your priorities when it comes to service from the city? What do we as the city of Austin need to invest in within our communities to ensure the health of all of our residents? What health resources do you feel are missing from our community? Those are just a few sample prompts to get us going. And if someone wants to kick us off, that would be fantastic. We are ready for you. Who's going to be the brave one? Let me go back. There was a question that Sarita addressed, but I'll read it word for word for our interpreters. Lisa says, in a flat budget year, wouldn't the primary focus be how and if to shift funding to achieve more equity versus maintaining the status quo? Where did that decision get made? And Becky from the Commission for Women says, Lisa, great question. In our roles as commissioners, we may recommend shifts in funding, where to spend more or less to address equity. We have someone, Serena, here. With the limited funding that Austin Public Health has, how much of it is going to COVID-19 vaccination distribution? So I will say this is primarily for input into the budget process. I will, since Adrienne is here, I'll leave it up to Adrienne in case she has these answers. But if not, what we'll do is record these questions and kind of circle back to you if you want to leave your contact information.
I don't have that exact figure this evening, so I can definitely get that back. I can circle back to the commission to let folks know. I will say that out of a staff of nearly 500, 80% of the staff are deployed in vaccine response. So just in terms of human resource capital, it is an all hands on deck effort. We do have support from other departments because we wouldn't be able to manage it on our own. And we are spending a significant amount on additional personnel resources to support this effort, as was mentioned at the top of the call. Not anything particular to Austin, but nationally, public health departments have been seriously underfunded, and we are feeling the effects of that, trying to manage the pandemic response.
Thank you, Adrienne. And I think, Serena, that is something that you could bring into the space with commissioners too, if you are seeing what's going on in your community and you're seeing some gaps, that's something that commissioners are hoping to address in their recommendations. So if you do want to speak to any of that, you're more than welcome to take yourself off mute.
Sure. Thanks, Amanda. I was just curious, I actually work in the community as well. I work for Nurse Family Partnership at Any Baby Can. And we have, just seen, the way COVID has, really affected our patient population. And then more personally, I've, throughout the community, we've seen that. And I just think the biggest issue seems to be, as of now, COVID vaccine distribution. It just seems like there isn't enough information. I feel like a lot of my clients, and as well as family and friends, don't really understand the process, where to get a vaccine, how to sign up, what the effects are. I think a lot of people are scared. And I think it would be really beneficial to have maybe some more information rolled out from Austin Public Health to the communities in some way. I don't know if maybe more